This conference will now be recorded.
Andy, I hate you. You guys are killing me.
Okay,
Okay, why don't you try that again? Take two.
Right. I would like to welcome everyone to the Town of Southbridge Board of Health meeting for April 15th, 2021. We are opening the meeting. It is 6:05 p.m. Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the open meeting law and the Governor's March 15th, 2020 order imposing strict limitation on the number of people that may gather in one place, this meeting of the Southbridge Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and/or parties with a right and/or requirement to attend this meeting can be found on the Town of Southbridge website, www.ci.southbridge.ma.us. For this meeting, members of the public who wish to watch the meeting may do so in the following manner, as usual, via cable access TV Charter Spectrum 192. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. In the event that we are unable to do so, despite best efforts, we will post on the Town of Southbridge website an audio or video recording, transcript, or other comprehensive records of proceedings as soon as possible after the meeting. Okay. So we have opened the meeting. It is 6:05. Agenda item number 2, roll call.
Beth Stevens,
Yes, here.
Roland Larochelle,
Here.
Nicole Duffy,
Here.
Anthony Pastali.
Excused.
excused.
Thank you. That's a good roll call.
All right, agenda item number 3, accept meeting minutes from March 11th, 2021. Did you guys get a chance to look at them?
I didn't see any issues with them. Make a motion that we accept them as written.
They seem okay.
Do we have a motion to accept?
So move.
And a second?
Second. A second.
All right, roll call vote.
Beth Stevens,
Abstain as I was not present for that meeting.
Nicole Duffy,
Yes.
Roland Larochelle.
Yes.
Thank you.
Okay, moving on. Agenda item number 4, citizens forum. Is there anyone present for this meeting that would like to discuss any topic that is not currently on tonight's agenda? Okay. Moving on. Agenda item number 5, Andy, COVID-19 update.
Just putting it out there, we're kind of in a status quo situation right now, trying to get the vaccine into people. Not a lot of new news on the vaccine front, other than the obvious, I don't want to use the word concern, but the addressing the J&J vaccine. Apparently 6 persons had some blood clotting out of the
Actually,
6.8.
7.
It is
They
7
added
now?
one. They added 1 today.
Okay, out of the 6.8 million doses that was given, it comes out to like 0.000089%, which, and they haven't really confirmed that it's directly linked to it. The events seem to be taking place between people between the ages of 18 and 40, and in females. Again, very few cases. Town of Southbridge update. As of yesterday, we had 1788. I haven't reported to the powers yet, but we had 2 more cases today. So we have 1790 with 61 active cases right now. There has been some discussion and I'm sure you've heard it on the news, that minorities and special populations are not receiving equivalent doses of vaccine. They're being underserved. I get a report from the state periodically. We are at 20, as of today, we're at 3,080 total vaccines in the town of Southbridge. They didn't report on the Hispanic population, which is our largest population in the town. But as of last week, we had 1,500 of the Spanish population that were fully vaccinated. So we are over 15% of the vaccines that we have distributed have been to the minority. So I don't know if Southbridge is an anomaly, but we are, in my opinion, adequately serving the Hispanic population. The white population was 800 and something as of last week. So I don't see that disservice in the town of Southbridge, and I guess I'm pretty proud to announce that I don't see that. Other than that, if there's any questions about COVID-19, I would turn it over to, if there aren't any questions, I'll turn it over to Roland to give us an update on the status of the clinic and the status of the homebound project that we're trying to reach out to.
Actually, I have a question, Andy. Are we in the yellow right now? And how long have we been in the yellow, if that's the case?
I'm sorry, yes, we continue to be in the yellow. We are at a 3.06, I believe, positivity rate, and we are at 22 cases per day per 100,000 equivalent. So in order to get out of the yellow, we have to get under 2 and under 10 on the, no, I think we have to get under 10 total cases. I can look that up in 2 seconds while Roland's talking.
How long has it been since you've been in the red?
I think we're on our 4th week right now.
Okay, thank you.
Yeah, we were, Nicole, we were in the yellow at our last meeting when we voted to open the town hall on the 22nd and to keep it open as long as the town of Southbridge, not state, because the population demographics and numbers are skewed different. What happens in Boston doesn't necessarily reflect here. So as long as we stay in the yellow,
Yeah, exactly.
yeah.
Exactly. That's why I wanted to know how long it's been. Yeah. Thank you.
All right, since Andy walked away, the clinic is open 7 days a week. We're open weekends now, 8 a.m. till 2 p.m. The J&J is on hold. The Johnson & Johnson is on hold. It has been in short supply and was being predominantly, for the most part, saved for the homebound. Specifically because of logistics, it's a one and done so that we don't have to go back. So far in the town of Southbridge, we have done 8 homebound citizens. I use the state worksheet to validate people. I have found out that there's been a lot of miscued information because a lot of people thought they were homebound because they didn't know how to get there. They had to take a chair van to their doctor. After talking to them and researching and proving it, and I have had return phone calls, if you can take a chair van to your doctor's appointment, this is a medical facility. Your Medicare and your Mass Health will pay for you to have a chair van take you there. We had an ambulance there the other day for an non-ambulatory person by ambulance. We had a chair van yesterday. So it's working very well. And during the week, they're pushing probably on an average 600 people through there. And I looked at the numbers. Today's Thursday. Yeah, yesterday. It was almost 32,000 shots given through that small community center. So that's going very well. I had roughly 26 people on the homebound list that was given to me, and I have whittled that down to 11, and nobody was upset. Nobody was mad at me. Nobody threatened my life. Everybody was appreciative on the information that they got, and it afforded, it's a logistical nightmare And it's not as easy as people think, because the minute you thaw out a Pfizer, you get 6 doses out of that bottle and you have 6 hours to use it. When Johnson & Johnson was still being used, and I assume it won't be long before it's used again, once it's taken out of the freezer and drawn up, you have 2 hours. So it is a real logistical challenge for some of our brother and sister communities, like just driving out to West Brookfield. You're going to take roughly 1 shot, because you better hope that you have somebody with blue lights that can bring you out there, that can get around traffic problems, because you've only got 2 hours before you have to throw it away. And I will tell you, I have the amount of vaccines that they have wasted down at that facility has been slim to none. So they should be very, very proud of their actions. So we're right on track. I have a couple other people for homebound, but it is, we're not going out every week. We're going to compile it so that we can get the maximum dosage. Right now it's Pfizer. So I'm not entertaining more homebounds until we can get basically 5. And if it goes on for several weeks, we work with other towns that if I have 3, we'll fill the other 2 out of another close community. But so far it's working, and we've had nothing but positive reports.
Any questions, Nicole?
No, not this time.
Okay, so I'm just looking at the time. So before we move on, we do have a public hearing scheduled for 6:15 for request for a septic variance at 3 Grandview Drive.
Septic plan. Okay, is,
So Andy, was there information that came with this?
excuse me, there was, unfortunately, this is the information that comes with it. And I don't have the ability to scan this down and email it to you. And because we are in remote meetings, I try to get all the information for the meeting I can to you, but I can't scan a set of plans down. So we were going over this today. I was working with Jason to see if he had them on computer, and he didn't have them ready to send on computer. So unfortunately, we couldn't get them to you. We were doing everything we could, the engineer and I. So I apologize for not having that information in your hands.
Roland?
Andy,
Yeah, man.
why is this in front of us as a hearing?
He's looking for some relief from a couple of things in the requirements of Title V. It's a very
Okay.
tight site we have.
Okay, let's stop right there. That does not require plans. I cannot, in good judgment, sit here when we have a public hearing and have absolutely zero information on the requirements of this public hearing and the request. How do you expect me to make a sound judgment? Number one. Number two, if there are, and we've done this before, if there are tight setbacks, and if the person by DEP regulations cannot do it by the first phase, but they're allowed in the second phase, why does it have to come in front of the board? We've had this discussion in the past, and I cannot vote on materials. How long has this been out? Because the town hall is open. A copy of those plans could have been made just like the council packets, just like my wife gets her packet for her subcommittee, and we could have been notified to go pick it up. So a virtual meeting is not an excuse to have board members be required to make a vote and a decision with absolutely the only thing that I have for information is the agenda. Public hearing request for septic variance at 3 Grandview. Unacceptable, and I will not vote on this.
I mean, I don't understand. I mean, to me, like, if you're gonna put something on our agenda and request a hearing, then you need to have documents in hand before that's gonna go on the agenda from now on, because I don't know anything about this. I know nothing. I don't understand.
From this point forward, virtual meeting or regular meeting, we will create a physical packet and we will ask the board members to come in and pick up a packet.
That's,
We
oh,
discussed
I
this
apologize.
before.
This is the way we've done it through the COVID. If you wish a change,
I
I
have
will.
not, no, Andy,
No,
the
no,
variant.
you are
This is the way
completely
we've done it through the COVID.
And we
If
have
you wish a
also had,
change, I will accommodate that change.
and we have, Andy, and we have also had the information given to us, albeit usually the day before, but how, I have nothing, I don't have any information about this except what you have on here, which is the request of variance, but I have no documentation whatsoever. So I don't understand.
Understand, I am working on precedent. The last time we did this, this is the way we did it. If the board
And
is
we
requesting,
had,
if the
and
board is
we had,
requesting that I change this, I will change this.
Wow.
I will
and
have it,
we
I will
had-
have it in your
go
packet.
and wait. And we also had the information before the meeting. I don't have any information about this. That's what I'm trying to tell you. So in the past, we have always, sometimes it's been close, but we have always had the documentation to go along with this in time for the meeting. And this one, we do not.
The last time we had this, and I'm tired of hearing COVID as a crutch. We were sent the application. We were sent a plot plan. In the application, there was the explanation of why.
Exactly.
Camera, you continued and you added the explanations on why they couldn't do it and why they needed it. But we had dates, we had times, we had locations, we had drawings, we had plot plans, and we had the application. Tonight, I have nothing, and it's not because of COVID.
I mean, when did they submit the application?
We got the completed packet on Monday.
Okay, so why didn't it go out Monday? Exactly. So it's Thursday. So why didn't it go out Monday with all of the other stuff that we have for the meeting? That's what's supposed to happen. I can't in good conscience make a decision about something if I know nothing. I don't even know where Grandview Drive is. I know nothing.
Do we have the capabilities of seeing that?
So I'm not sure, and it's too late now because we're in the middle of a meeting. So how are we supposed to, be able to look at something and know what we're looking at?
If the board is not comfortable with moving on
While
it,
we're at it, I do have one other question for you. Are these variances, do you have the ability to make a determination by yourself to approve a variance or not?
I do not have the authority unless the board grants me that authority. Much like the Beaver situation where the board said I can approve a Beaver application for the water. If the board wants to give me the authority, they can, but the authority lies with the board.
Okay. I just wanted to check because we have had situations where there are other things that you do have the ability to do and somehow they still come to the board. So I just want to be sure that this is not something that you can do.
It is
Okay.
it is my understanding of Chapter 111, where I am appointed, that I can work on behalf of the board, but ultimately it's the board's authority. So I
Okay.
try to bring everything that strays from the norm to the board. If the board wants me to have further authority, they can grant it.
Well, that'll be a discussion for another day, I guess. I don't know, Nicole, do you have anything that you would like to?
No comment.
I mean, I just, I feel bad, but I just don't understand how we're supposed to be able to make decisions about things if we don't have the information.
Wrong thing.
Yes, he sent the wrong one. If the board wants to table this until I can get them hard copies of this plan, then there should be a motion to table it.
Roland, what do you guys want to do?
You're on mute, Roland.
I don't even think that we have to table this because there is no action to take because there is no information. So I don't know what tabling for what reason, because we have no information. I don't get it. I just don't get it.
Yeah, there are a lot of that.
Public hearing's not taking place.
So,
Madam Chair, I vote to close the public hearing. Close the public hearing at this time and no action.
do I have a second?
I'll second.
All right. Voice vote?
Beth Stevens,
Yes.
Nicole Duffy,
Yes,
Roland Larishell.
Yes,
What time is it?
6:25.
6:25.
6:25.
All right, so back to our COVID update. Andy, prom. I put this on the agenda because Nicole had requested. I believe you have some, I know we have a statement from Dr. Villar, but I believe you have update on the regulations.
I talked to Karen Checker today. According to her, the school is not planning to hold the prom this year, so it's irrelevant.
Okay.
one of the reasons, actually why I wanted it on the agenda was I had heard the same thing. And I'm pretty concerned about that based on, as I've spoken before, about how we're pretty much in a mental health crisis. And as we had spoken before, I was looking to actually, find things to connect, especially the teenagers. And, this is pretty detrimental. And I know they made the decision and that's theirs. But I feel that, I feel that if it's at all possible, we can actually have a discussion about it and maybe ask them to consider that based on factors. So I don't know how you both feel about it.
Department of Health.
So Andy, what does the regulation say from the state?
The regulations basically encourage the holding of if you're going to hold a prom, to hold it after the closing of school, basically in the summer, to give the attending students time to get the vaccine and to have that 14-day window. The school felt it would become an irrelevant act on their part to do that late in the year. They also the regulations refer to the guidance on separation and social distancing, and sitting people 6 feet apart at a prom made no sense in school. So from what Karen told me, that's the sense I got, was that it would have been a group of people sitting 4 to a table 6 feet apart from each other. Would have been a social gathering, not a prom.
And what does, and Desi, from what I read, said that they were not having, they were not promoting proms anywhere. Is that, did I understand
No,
that
that's
correctly?
not, no, that's not true, actually. Bay Path is actually having their prom.
Yes, but the DESI guidance allows it, but I think it clearly states, if you read the documents I did send you, that or the link that I did send you, it clearly states that they do not encourage them. They are not in favor of them.
Right. I did read it and they suggested it. They suggested it and that was that. But like I said, Bay Path's having it. They're actually having all seniors. They're having 2 separate proms. Based on, what I read, I would agree, what, if they wanted to, wait later and after that, absolutely. I'm just feeling that it's very important. And again, it's not our call, but I feel that, it's worth a discussion, and to ask him if he would reconsider the other factors. There wasn't really a discussion about it at all. I mean, I know that's not on us, but I feel that, especially given our circumstances, you're talking about seniors, they didn't go to their junior prom and now it's a senior prom. And as I said, it's a mental health crisis, and this is a real make or break point. This is kind of like, just that will really connect them. And it just, I feel strongly about it. And I just wanted to kind of put that out there. And if it's at all possible, if you could reconsider, I would greatly appreciate that.
So I know that Dr. Villar, he actually did send us an email, and as he said, I will follow the guidance from DESE, which suggests the district do not hold a prom. Additionally, we plan to follow the state guidance for graduation and any additional safety requirements suggested by us, the Board of Health. So thus far, he has followed DESE to the letter, and I don't know that it really matters. I'm not inclined to try and force his hand to do something that he doesn't feel is going to be right for our school. And I understand what you're saying, Nicole. I totally do. I'm more concerned about graduation and allowing them to have some kind of graduation than I am about a prom.
Oh, and I agree with you on that as well. I just feel that, with this, it's just, there's other variables, and not to mention that, they're basically having all the kids go back to school anyway. But I just want to put that out there.
So noted. Roland, do you have anything to add?
Not really. We could talk about this for hours like we did on Halloween. For any of the kids out there, yeah, I remember my prom. I know this situation is terrible. And, but I will tell you, to have the school sponsor a prom is one thing. And I'm going to open the door and probably put my foot in my mouth, but if a group of students get together small and it's not school sponsored, then it's not up to Dr. Villar. My other concern is simply this. Most of you know I have a personal vendetta against this bug because I will never be able to celebrate my brother's birthday because of this bug. And I pray to God that nobody suffers the same thing, because a dance can go on with a small group on the beach in a week. But to have a large prom and then go to a funeral, that's a bitch. And I lived it, excuse my French. But I don't want to see anybody else.
I got it.
Okay.
So Andy, I mean,
Yeah.
I guess, there's really not anything, there's not really anything for us to do. I mean,
I was just looking to see if he would reconsider after, if we could speak about it, but I didn't know what your feelings were about that or yours, Roland. So that's what I wanted to bring to.
Remember, from working with him in the past, I mean, number one, we get the weekly reports of the school system. And I think if my memory serves me right, the last weekly report in a 7-day average, there were 7 positive cases in the entire school system, and 4 of them were remote students.
Right.
That includes not students, teachers, aides, bus drivers, cafeteria workers, maintenance people, everybody employed by the school system, the Southbridge school system. The only thing that concerns me is exactly what Andy said. Andy Chocolate Checker. Dr. Villar does the Southbridge school system. I don't know if Trinity is planning to do anything. Dr.
Yeah, I'm not
Villar,
sure.
they have no control, but from what I've seen with the numbers, Trinity has been doing an equally fantastic job of keeping this bug out. And it's like, this is something none of us have lived through. And I just pray to God that taking the lumps is going to allow us to all live further on. The graduation, to me, if I was going through it, guess what? I'm gonna have a prom. My clique is gonna get together and we're gonna play some music and have some dancing. But it's gonna be in small groups like you can at a wedding. But to have a sponsored prom, and if I was a senior again back 110 years ago, I would vote to make sure that my graduation was there.
Oh, absolutely. Absolutely, I agree. Graduation is top notch, but the prom is the thing that's coming up first, and I just wanted to know what your thoughts were on that first.
Yeah,
And like I said, it's just a talk and collect really the other, just to see the other aspects and ask to be reconsidered if that's it. I want to know what you both thought.
yeah, it's a no-win situation.
All right. Andy, so what, so now, I guess we'll move on to graduation. So what did Karen mention anything about graduation?
We talked briefly about graduation. The school has under 100 seniors this year. They feel that they can meet DESI's guidance in an outdoor venue. So they have several days planned for primary and then backup days, but they are going to hold an outdoor event for the seniors. They're going to limit guests, maintain social distancing, meet the DESI guidance and the Massachusetts State social distancing guidance.
So they are planning on doing a graduation.
They are, and because they want to keep it outside, they're going to have backup days in case the weather goes bad.
In case the weather. Okay, well, that's good. So at least they have something to look forward to. This has been a crazy year. Anybody have anything to add?
No.
Roland, you good? Okay. All right. Moving on, agenda item number 6, new business. Proposed community access refrigerator, the Bridge Fridge. Andrew?
Through some Facebook links, it was brought to our attention that there was a proposed Bridge Fridge. Bridge Fridge appears to be a community access refrigerator that is basically available 24/7 for persons to bring food and place it in the fridge or to go and get foods out of the fridge. We spent some time tracking down the persons who are proposing the Bridge Fridge. As of today, we received a plan, which we haven't had time to go in depth into reviewing yet. But and the plan still does not say where it's going to be.
Nope.
The plan does not express the location of this. Ms. Maritza, our food inspector, and myself reviewed what we could in the period we had. Again, more in depth is going to be required. I think it's feasible that it could happen. I believe we'll have to talk to the organizers about permitting because I believe it is a public food outlet. We'll need to know locations. So I think it can be pulled off, but we'll need to be in contact with the organizers on a more one-to-one so that we can work through some of the concerns and conditions that may apply to it.
Okay, and I see some faces. I'm guessing there that you guys are from the Bridge Fridge.
Yes, yes.
Okay,
My name is Carla.
So
Sorry.
Go ahead, sorry.
Hi, welcome.
welcome. Thank you for coming. So what exactly is your proposal?
So just to answer Mr. Pelletier's question, it's going to be in RMG, the Renaissance Medical Group, right outside between the two doors. I don't know if you guys are familiar where RMG is, the site. So the Bridge Community Fridge is basically a grassroots mutual aid initiative that aims to combat food insecurities and food waste in hopefully the town of Southbridge. We organize and place free food fridges that are, like Mr. Pelletier said, 24/7 access to community members, no questions asked. These fridges are organized, maintained, and used by the community. The free food provides community members with a dignified way to access whole, nutritious foods with no barriers. I'm not sure if you guys received the food safety protocol we sent in, but okay. So I'll go through it a little bit. I won't go in depth since you guys do have it. So the plan is basically to allow produce, breads, pastries, pantry staples, prepackaged, non-potentially hazardous foods, commercially packaged meals, packaged and labeled dairy and deli items, unopened frozen cooked foods. Items we don't accept are raw meats, expired food items. Sorry, just going through it.
So I do have
Sure.
just have a question. When, because I have seen this
Mhm.
for a little while, and I'm just a little curious why you guys were asked to reach out to the Board of Health office on multiple occasions and you guys chose not to. So I'm just a little curious why you've been so secretive about doing this.
So when we first were approached, it was through a Facebook page that we did not recognize, so we didn't think it was a valid.
So that was
thing.
me. I asked you guys to make sure that you looked into the Board of Health and Inspection office, and the reply was, oh yeah, well, we're working with somebody from Worcester, and so it's okay. And then I did mention to you that bylaws and regulations are different from town to town. And then I continue to see advertisements and fundraisers and everything. And then I asked you guys again if you reached out to the office, and you ignored it. I have a problem with that.
So we do apologize for that, where we weren't trying to avoid you guys at all. It's just we were under the impression that we didn't have to go through the Board of Health, and that was the only reason.
And I don't know why anyone would have given you that impression, because anything that has to do with food has to go through that office.
Okay.
So
and we're here, so we're willing to do whatever you guys
I
ask.
think this is a great idea. I'm just putting it out there that I feel like you guys were really wrong by ignoring us when we continually asked you to reach out to us.
And we
So
apologize for that.
I just want that to be known, because I do think it's a good idea. And that's what really
we appreciate that, and we do apologize for that. And that was the only reason why we didn't reach out in the first place. But we're willing to do whatever the board says.
I mean, I guess that's the part that just bothers me about it. Even if you didn't recognize it, all you had to do was just call and say, hey, somebody posted this. Am I supposed to contact you about our project? That's all you had to do.
Right.
And you guys seem to have real initiative, but I just think that was a huge mistake.
Apologize for that.
So, Andy, so I know we still need a little bit of time to go over, but do we know anything about anything they need to do as far as regulation goes?
Well, what I'm going to do is reach out to this phone number that was presented to me, the number that ends in 89. Whose number is that?
That's ours, yeah.
Okay, so I will reach out to that number and arrange a meeting to come in the office and sit with myself and Miss Maritza, talk about permitting of this thing, talking about oversight of this thing, and what requirements. We're dealing with some potentially hazardous foods, so we'll talk about food certifications. We'll iron it all out. We'll either make it happen, come to terms on what we need, or we'll reference, obviously, any concerns. I'll reach out to the state to make sure that they're okay with the direction that we're going if we can't come to terms.
Okay, thank you so much.
Roland,
So I will have Maritza reach out tomorrow.
I'm sorry, my name is Julie.
Yes.
I'd like also to say that this was created in the best of intentions. and
Oh, I
whatever
understand.
regulations are, that we are willing to meet those regulations, whatever it takes to make this happen.
Oh, I don't dispute, I don't dispute at all that you guys have good intentions. Like I said, I think it's a great idea, but I'm just upset about the way you about how you guys went about it. Because we tried multiple times to try and contact you guys, and I just feel like, I just feel like it was just kind of wrong that we were blown off. I'm not saying that that as a board,
There you go.
I'm not saying it's a bad thing.
Going forward, our communications will not be lapsed.
Perfect.
We'll meet your questions, and we'll meet the regulations. That's all.
Roland, Nicole?
I have a couple of thoughts, comments. When did you forward your, the safety protocol? Do you remember?
It was this morning.
Okay. Because I personally didn't receive it till 1:26 today. And to be honest with you, with everything I have going on in my life, I did not have a chance to read it verbatim. That really challenges me, and I was not in good business sense. I am not saying that there's anything wrong, but I will entertain some things on my cynical side for something, because I don't know if you people have addressed this. Is this a fridge or a fridge freezer?
It's both.
It's both. Okay.
Mhm.
I've learned a lot of things working down the clinic. Are you going to have any remote monitoring as far as temperature that will send an alert to, I mean, this is the time of technology, send an alert to phones and this type of stuff if there is a power outage or things of that nature, so somebody can get down and have their eyes on the product and to monitor the temperature and how long. That is number one. And number two, the major cynical part of me. That's going to be sitting alone outside. And I don't care what part of town or whatever town. Doing a good thing, it takes one nasty person to derail a train forever.
Mhm.
We see the nightmares of somebody tainting aspirin in a pharmacy. And how much, I mean, that's lighted, there's people there and everything else. Are you going to have video surveillance in some kind of system like a lot of people have in their house, that if there's motion, that it will alert somebody, so that if you see somebody doing something that's questionable, a call can be made to the police, so that the police are down there before one of your members are there? And I'm just saying this to be, I don't know if I'm over cynical, overprotective, but this is 2021, and we've all seen the worst of the worst, and we have all seen the best of the best. And a small fraction of the worst can really saturate the desires of the best. The thing that Beth is talking about too, that goes on social media, that can be our friend or our worst enemy, is that when it was out on social media and we're getting phone calls from the public and from town officials going, hey, what's with the bridge fridge? And we're going as Board of Health members, and we're saying, what are you talking about? That's not a good start with us. I'm not blaming anybody. From what Julie said, that the information's going to get better, which is fine. But I'm sure I share the concerns about safety. I'm glad to see that you were talking prepared foods, not homemade, so that they're packaging their produce.
Mhm.
But some people can do nasty stuff. This is the time of, the internet.
Mhm.
Take some Visine and shoot it into an orange, and then watch that person. And if you don't know what that will do, Google it, and you'll call me some kind of a nutcase, because that gives you a severe case of the runs. So it can be something as simple, and I only know this because of my schooling and my past job, not because I've
I
ever been.
appreciate it. Thank you.
But that's some of the challenges, and there's people that need to help, and the unfortunate thing is I agree, the people that need the help are going to use that service at 3 in the morning because they're embarrassed and they don't realize this is not 1927 anymore. There's help out there and there's nothing embarrassing. Movie stars have 4, 5, 6 psychologists on retainer because it's a status thing. It's not something to be ashamed of. So, but a lot of people still grasp that, and I understand it. But you know, I'm glad to see that you are taking some precautions, and if you're going to do that monitoring for both to make sure it's properly used and not abused, as well as the temperature thing, because I don't know if that facility. God, I did work down there back when United Lens had it, and I don't think it had a backup generator there. I'm showing my age. But I don't know, like any other refrigerator, it'll last as long as people don't use it. But if there's a power outage, as long as it's monitored and you have somebody that is going to be willing to, like a lot of us do this because of it's the right thing to do, we will get up at 3 in the morning and take a ride and go check it. You know, but most people won't. But if you're going to do that, I appreciate it. And then, you know, you can work with Andy and Maritza on any kind of accountability stuff. That's their forte. But I apologize. I only got the email at 1:30 this afternoon, and I really did not have time to thoroughly.
No, thank you. We appreciate everything you had to say. So RNG does have cameras. They've been very gracious with us and they're willing to work with us. They're even going to have some of their staff look towards the fridge and make sure it looks good. But we're also going to have volunteers that will be there at least twice a day, not only to clean, but to organize the area. And we actually just bought thermometers to make sure that they're set inside to make sure that the temperature is well for both the freezer and the fridge. So that's something that we did think of, but we do appreciate everything you have to say, and we thank you guys, to tell you the truth, and we hope that you guys volunteer as well. You know, be part of our great initiative and be part of it. We would love to have you guys if this works out. You know, if the board agrees with everything. So,
Nicole, I know you want to say something.
Yes, I do. Hi,
Really cut you
Desenia.
off.
Hi, Carla. It's great to have you guys here, and I got to tell you, it's like I'm really liking the whole grassroots thing. I'm a big fan of it, and it sounds great. And I read over a little bit, and I did see how you were going to be inspecting that twice a day and so forth, and I think that's great. I didn't catch, however, where the location was exactly. I don't know if you could explain that again.
yeah, it's in the Renaissance Medical Group, 11 Saundersdale Road, right next to, what's that area next, Jasenia? Next to it?
Across
It's
from
right-
Golden Creek.
Yep.
Right,
Yeah.
right across from
Perfect,
Golden
yeah.
Creek, just before the village.
Oh,
Fair.
I know exactly. Okay, I got you.
Yeah.
So is it going to be just a fridge and a freezer outside of that, and
Yeah, it's
people
gonna
can just
be-
walk in and get it?
Yep, so it's gonna be a fridge. We actually have an upright freezer as well, and there's gonna be like a pantry area as well. We actually also have a woman that's willing to donate pet food for the pets as well.
Great. Great.
So it's all being like, we have a carpenter that's donating his time, and he's gonna be building the enclosure, so it's all gonna be together, and it's gonna be less than 100 square feet as well.
Great. Now, what is I mean, you know, granted, if everything goes smooth and so forth, which what are you looking at as far as like the start date that you're looking? What's your estimated start date that you're looking for?
We haven't established that because we wanted to make sure that not only this is approved, but also we wanted to give time to the folks that are helping. Like we have painters that are going to be painting the enclosure. We have the carpenter that's going to be building the enclosure. And I didn't want to set an actual date until I knew how long they needed for those items.
Smart move, very smart move.
Yeah.
We actually just secured the fridge and the freezer within like the last 2 weeks. So this has all just been the planning
Yeah.
mode and moving
I
forward
see.
with that stuff.
Okay, great. Thank you so much.
Thank you.
Anyone have anything else?
I will be in touch with Miss Carla.
Thank
Actually,
you.
I'll have Miss Maritza call Miss Carla tomorrow, and we'll
Okay.
set something up for next week. I don't
Awesome.
imagine it'll take too long. We just got to iron some stuff out.
Sure.
Permitting, stuff
Thank
like
you.
that.
Okay, thank you all so much. We really appreciate you. And Mr. LaRoche, I'm so sorry about your loss too. That really touched me.
And Andy, once you've ironed it out, can you email us like we discussed on, we do not need to wait till the next monthly meeting to be informed that we're giving them permission and what the provisions that you've worked out and what they've complied with. So let us know that once you give me okay. Send us an email and we'll know. We don't have to wait till the next meeting.
No, it's my opinion, and the board can correct me if they feel, but if we can make this comply with the food code, it would be just like any other food establishment. We would issue the permit. Ultimately, what we'll get out of this is a revised food protection plan, which is really going to be their operations plan, and we'll just email the completed plan once we work it out with Miss Carla, and she amends the plan. We'll just forward the whole plan to the board.
All right, just keep us informed by email that it's been approved, so that way when we receive questions, we can give the people the correct answer.
Thank you all for your time.
Thank you so much, guys. I look forward to, we look forward to working with you on this project.
Thank you so
Absolutely. Thank you, ladies.
Thank you.
Thank you so much.
What's
Are we
that, love?
okay to leave? Yeah, okay. Thank
don't
you so
have to
much.
stay. You don't have to stay.
All right. Thank you so much, everybody.
You're welcome.
Thank you. All right.
All right, municipal opt-out of mosquito spraying.
After people went away. Each year, the if you're part of a mosquito control program, which we are not, or if Massachusetts opts to do statewide spraying, they allow the town the right to opt out of the spraying. So this was sent to the town manager as the head of the municipality, and he forwarded it to the board for consideration. Last year, if you remember right, we were involved in some mosquito spray and flyovers.
Are we not this year?
This year, not yet. There have not been any yet.
Okay.
So the question becomes, does this board want to support or not support and opt out? Opting out would mean that they are going to shut their sprayers off when they go over the town of Southbridge and turn them back on when they get to the next community. If you remember last year, we did get some areas in Southbridge sprayed, but there was also some negative response to that from some of the citizens who are worried about contamination of lakes and swamps and stuff like that. The spraying is supposedly a chemical that neutralizes in the sunshine. So it goes down, it kills the larvae, and then neutralizes out. It is also a targeted, they call it a adulticide, or I forget the other word, but it either kills adults or it kills larvae, and then it neutralizes in the sun. But it's targeted to mosquitoes.
So Andy, before we move on, I have a statement from Councilor Marchetti that he would like read into the record. But I also, so I just don't want to forget that. But also, did you read through how to opt out and all that you have to do in order to opt out?
I did not read through that. If the board chooses to opt out, then I will familiarize myself with the steps we have to do that.
So one is not independent of the other. If we were to decide to recommend to opt out, because it is not our decision, it is up to the town council, we are purely for a recommendation. There is a whole slew of rules and things that you have to do in order to opt out. One of those things is to have an alternative mosquito plan that is approved by the state. And all of this has to be done before May 15th. So currently we don't have a plan. So I don't know It's like a whole list of 7 things with like A to E regulations that you have to do and things you have to have in place in order to opt out. So I'm not sure. I had to read it 3 times because there's so much. I don't see any reason to recommend us to opt out just based on the timeline. There's no way that we're going to get a plan and get it in front of the town council for comments from the public and also get the plan approved by the state in order to opt out in 4 weeks. I don't see that as a possibility. Roland, you're muted.
I didn't say anything until I'm recognized.
Oh,
Andy, after receiving this at almost 3:30 yesterday, I was able to read some of it. This does not pertain to us because, let me just read something. The following steps, and it's a link off the first page. The following steps must be completed by the municipality prior to submitting a plan to EEA for the review. The municipality must hold a meeting of the city council or select board in which a vote must be taken to indicate the municipality's intention to opt out of spraying, which includes aerial or other type, conducted. The meeting should include input on the plan from the local board of health. We do not have a plan on mosquito control, do we?
We do not.
Okay, so we're out of it right there because we cannot offer the council a plan, because the way I read this, and I didn't have time to really digest it, which will be for another discussion. The way I'm leading to believe here is that the town of Southbridge is going to get sprayed. You're either going to take the state free spray, which by going by last year's very in-depth presentation of the biodegradable products that they use when we were entertaining spending $60,000 to get into the mosquito control program, if we were already in it, we could submit a plan, which we would have one because we were in it. And then the town council would be the ones to vote to opt out. And then the state would not spray Southbridge because we already have a plan. But since we don't have a plan, there is no way in this God's green earth that this town is going to get a plan if they intend to opt out and file all the other things, including a public hearing that it states on this piece of paper, by the 15th of May. So that being said, because we don't have a plan, this whole agenda item is a moot point because we don't have any legal standing to opt out, the way I read this. And it will be up to the council. So like it says, input on the plan from the local board of health and allow for public comment. We cannot afford the town council any opinions because we don't have a plan.
we don't even have a plan.
So I do not think this thing right here, the way I read this quickly, is that the town of Southbridge has no availability to opt out. It doesn't apply to us.
So I guess I should probably just read this into the record so that it's there before I forget and we continue this discussion. It says, there is an agenda item on tonight's Board of Health meeting under new business, municipal opt-out of mosquito spraying, which I would like an opportunity to speak to. Unfortunately, I can't attend the Board of Health meeting due to Gen Gov budget meeting tonight. I don't know if there is any planned action on that agenda tonight, but if there is, would it be possible to read my statement below into the record? Spraying for mosquitoes is always a trade-off between public health and safety and the collateral damage it does to the environment. If you don't want to take a chance on EEE, West Nile virus, and malaria, you spray. Is spraying harmful to life forms such as bees, aquatic and vegetable gardens, and humans if inhaled? Usually the state doesn't spray in such a way that humans inhale it. Spray at night when people are in bed. Don't spray in heavily populated areas. Spray only in areas, water places where mosquitoes breed. Is there a risk to bees? Yes. Better they be at risk than people. Thank you, Councilor Marquetti. So back to discussion. So as Roland said, I read it. I don't know how we can advise on a plan if we don't have a plan to begin with.
Good. Okay, I will let Mr. McCall know that it is the intent of the board not to comment on it, as we cannot present an alternative plan.
Right. I mean, Nicole, do you have anything that you want to add?
Well, it's kind of hard since, it's kind of been presented. We don't have enough time with that, even if we did dispute the other side of that. So it's kind of hard to comment with that.
Andy, do you have that email up in front of you?
I do not. I have it on paper in front of me.
Okay, if you look on that paper, under
Yep.
municipal opt-out of mosquito spraying, that's in bold, go down 3 paragraphs where it says guidance and application information.
Yep.
The last word says here. That's what you click on. You click on that link.
Yep.
And that will give all the requirements and recommendations that Beth and I have been talking about, that we don't have any. So basically it doesn't apply to us because we have
Okay.
no right to opt out.
No, I wasn't questioning you.
No, but I'm saying if you're going to talk to Michael, I think he's going to ask, what do you mean? And back up your statement on why the board didn't do it. And if you have him pull this up or send it to him, click that link and it gives the directions on how to file and how a municipality qualifies, I should say, to file to opt out. And because we don't have a plan, we don't even qualify to do that. So we do not
Okay.
need a public forum. We do not need anything else. If somebody's got a complaint, they have to go to the state.
Okay, if the board supports, I will also put in a line or two about in future years, if the council wishes to investigate it, we can bring mosquito control in as an option for the town.
Right. Otherwise, I think so, because otherwise we don't, I feel like that's the only way that we can opt out, was if we were part of the regional mosquito control program. If we're not going to be.
But that
part of
being said, correct me if I'm wrong, we discussed this last year because the state was not doing statewide.
Right.
And that was going to cost us 60 grand.
Right.
Yep.
And then all of a sudden with this program, they are doing the entire state, and basically is saying that if you pay the 60 grand and have a plan, don't waste our time and don't waste our spray. We won't do your community. So if they're going to do it for free, have a nice day, because we will not have to look into our own plan. Because it's like anything else. If somebody provides a service and it's not working, we'll reach back to them and say it isn't working, come do it again. But if it's at no cost to the local taxpayer, because I'm sure it's cost to the state taxpayer, that's where it is now.
Ultimately, it is a cost to the local taxpayer. It comes off the cherry sheets that come into the town. So much money comes from the state to every town to help support the town's operations.
Right.
And the money to get on a mosquito control plan comes straight off the cherry street before it comes to the town. So it directly reduces our cherry sheet funding.
No, I know that. But if this is a state entity, we're paying for it anyway. But it's not coming out of local receipts. It's coming out of state receipts, which ultimately still comes from our pocketbook.
All right. So are we all set there?
Yep, I am.
All right. Moving on. Old business. 318 Main Street.
318 Main Street. We have an ongoing problem with trash at 318 Main Street. We have issued thousands of dollars of tickets on this one. I have been trying to find out how to get the courts to hear the tickets. They've gone through the 21D. The courts have been closed to minor concerns. However, we did manage to we couldn't get him into the housing court. So I sent Hector out on a mission. He went through the police department and he has filed those tickets as of today. So those tickets are filed. When the courts set the date for that, we will bring those tickets up and we will fight those tickets for every penny we wrote. We did manage to get it cleaned up this week. It has been cleaned since Monday afternoon. I'm not by any way, stretch, or means thinking that it's going to stay clean, but for now, it's been clean for the week. I was under the impression that the young lady who lived in that windowless bedroom had been moved out to a place in Dudley. We found out that she has not. Emily and I went there not last week, the week before. She is still in there. So I am currently preparing court papers on that one to bring Mr. Hunterfoot to court to get him to move her out of that room. So as soon as Mr. Caprera figures out how to file in the courts, we will have cases filed in the court. And I will start presenting those cases to him next week.
Andy, how much do we have in violations for that property?
I believe we have a total of $6,000 out on Mr. Hunterfoot. I think 4,000 of it is on that property.
Okay.
I have had Hector citing that property, finding that property every Tuesday and every Thursday, probably for a good 8 weeks now.
So, why only Tuesday and Thursday? I don't understand.
Because
Do the police only write tickets on
that's the
Monday?
schedule I
Wednesday, Friday?
decided on. Excuse me?
I said, do the police only write tickets on Monday, Wednesday, and Friday, and the rest of the week people get to go free?
Because that is a schedule that I settled on in order for him to work on his other concerns also. That was my choice. That was my choice. That was my direction.
Okay, but what is our blight law? What does it say? Does it say that you can only ticket 2 days a week?
No, it does not.
So you are intentionally not following the bylaw because you don't want to. I'm just asking. I mean, why, I don't understand why we have regulations if they're not enforced.
Because that is the schedule I chose to follow.
Okay. So just out of curiosity, how many violations does the liquor store have now? Do you know off the top of your head?
I do not know off the top of my head, and the liquor store has been decent for the last 4 to 5 weeks now. They come in and they clean it up when they get in.
Mostly, yes, but not completely. But I'm just asking.
I do not know what what tickets we have written on them at the moment.
Okay. Roland, do you have any? Oh, there's the hand.
Okay. Andy, if you don't hate me, you will. I have a special love for that landlord, and you're well aware of that.
I am.
I put my reputation on the line for that landlord, and he basically balked at us at 718 Main. The thing that really frustrates me is I sent you pictures. I sent you emails. My opinion is I sent you ammunition to follow a standard. And I got no reply until I CC'd Michael McCall. Now, I have the email sent right here that you said, as I previously mentioned, we have over $4,000 in fines. I don't know who you mentioned that to. I've never heard a money number to this board. That being said, I am looking at last month's minutes. 318 Main Street. Okay? He moved his tenants into 318 Main from 718 Main. He moved that girl into a closet, and you admitted that. The owner should be living in that closet, not his tenant. You reached out to the owner, who has indicated he would be pulling a permit for applications this week to work on an exterior window. Okay. That was, what, March 11th? Here's my question. How long has he owed the town money? Because in the following paragraph at the Vienna, you stated that you had conversations with the owner pertaining to the windows. He would submit a building permit. However, due to money owed to the town, the application has been denied. Why in the hell are we varying from standards and putting your neck in a noose for that single landlord? You mentioned that you tried to give him the olive
Two
branch.
different landlords. Two different landlords.
It
The
is.
landlord on Vienna was denied. He was never denied a permit.
Two
No,
different standards.
No, I'm not. The minutes of the last month is that when I spoke about the glass at the Vienna, the minutes state that the application has been denied until he gets in arrears. Correct?
Correct, on the Vienna.
All right, on the Vienna. On the email we got from Hunter Foot, you said at least $4,000 he owes the town.
Correct.
How the hell is he going to get a permit to put a window in that room if he owes the town money?
Because I have, Department of Public Health has the Department of Public Health has the authority to overrule that tax owed thing for a public health. I've done it several times. I did it right before I went on vacation for a leaking roof. We overrule it if there's a public health issue concerned. So if that permit comes in, he gets it.
And this has been a month. That poor girl should be moved out.
That girl's been living in that room since December. It's April.
When are we going to stop?
He's been living in there since December. I got.
You know.
So why, so hang on.
I did those pictures. I did those emails. Why? Because I have nothing better to do? No, because I'm getting phone calls. And I'm getting sick and tired of not having answers to give to the public. Because we know how much that particular landlord of 318 Main Street circles the drain, makes mockery out of every single one of us, and is allowed to get away with it. The common denominator of these people that have called me, and that includes town councilors, is shut him down. He is a detriment to his people. He is a detriment to this town. When the hell are we going to start following the rules and stop changing the rules depending on who the person is and cater to this piece of garbage who we have given chances? And I put my neck out and gave him a big chance. And I'm a big boy, and I told him right to his face on this computer, don't you ever say we got a vendetta against you. I gave him the chance. He agreed 2 weeks. You agreed 2 weeks, and I thank you for that. And he duped us. Well, he duped himself. And as far as I'm concerned, he should be all done. And my biggest problem is the lack of communication. Because, 318 Main Street goes back to April 3rd was my first email. And then I get this back from, because I copied it to Michael McCall because I don't know what other avenue to take. Because I don't get any answers that I can give the people that are asking me. And it is frustrating as hell. And I know it's frustrating as hell to you. But I got to live in this town 24/7 and listen to the people saying what the hell is going on. And I cannot say anything more than I don't know. And that is frustrating as hell. And that includes town councilors.
This town has spent a whole lot of money on that Central Street parking lot, and he's trashing it, and he's getting away with it on a daily basis. I'm tired of hearing it too from people. It's every single day. oh my God, what is going on over there? Why is there all this trash everywhere? Why is this allowed? They want to go through our trash and make us do stuff, but then they leave that laying there on our main street. I'm tired of hearing about it. 'Cause I'm in the same boat that Roland is, because I'm probably getting the same phone calls that he gets. And I know, I understand that there is some difficulty, but clearly, if this girl has been living in a closet since December, he has no intention whatsoever of putting an exterior window there, because it's now April and she's been there since December in a closet with no second egress. In fact, I could tell you the specific date because she texted me and told me she was living in a closet with no second egress. And yet somehow there's still no permit. He owes all this money, and this poor girl who doesn't have an alternative is still stuck in this room. I just don't, I don't know what else to say. I really don't. Because I feel like it's just the same thing over and over again, and nothing gets fixed.
And I will tell you, I don't envy you, Andy, because in your last statement, you took Emily there, and I can picture that smug look on his face when he told you, well, I don't check my mail. I would have been hard pressed not to grab him by the jugular vein. But now it's time that, you know what? What's going to make him use that comment? Because I would not believe him, and I'm looking out my window right now, and I wouldn't believe him if he told me it was raining. Close his ass. It's time to play hardball. Close his ass down. Treat his tenants more fairly than he is. I don't care anymore about this crap on who's going to pay his tenants. Put him in a frickin' hotel and attach his building again. Force this dirtbag out of town, whatever it takes. But this lollygag game to play with him, that he is just laughing his way all the way to Medicare fraud when he takes his tenants' money.
All right.
It's got to stop.
All right. Idlewood.
61
any
Idlewood
updates
Street.
on that?
This is one that 61 Idlewood Street. This is a lady living in filth. I'm sure you're familiar with it. As I expressed at the last meeting, we had done several meetings with her, trying to coax her into taking some assistance from Elder Services. We've been up there since then, at least once a week, and in some cases twice a week. Last visit was this morning. Actually, we tried yesterday, she wasn't in, so this morning we went up there. Again, I tried to get her to go with Elder Services. I told her I was going to file a case to get me in the building. I spoke with Rob Caprera today, and that is one of the 2 cases that we are prepared to file. She made statement that she knows my goal was to take her house. I clearly told her that was 100% not my goal. My goal is to keep her in her house, but that I need to get in to find the conditions and give her what services she needs in order to make the house livable again, including the exterior. She got frustrated. She referenced that she didn't really want to live at all, but that she did want to live her life out in the house. I told her that the case would be filed with the lawyer today, and that as soon as he could arrange filing it with the courts, that I was filing to get access to the property, and thereafter, depending on the condition of the property, if it was savable, I was going to file with the courts to have the courts order tenancy protection, which is a group that will help her clean the place. And I believe we can ask for RCAP Solution, which I believe is a group that will help her tighten the outside and close up the eaves and clean the place up. So I am at the point right now where I am ready to file it in court as soon as Mr. Caprera and I come to terms on the proper filing, and he has worked it out with the court on how to file in this period of remote access courts. The courts have only recently opened up for the less emergency type stuff.
So, quick question, Andy, you talked about these groups that will help her.
Yep.
It kind of sounds like maybe she's a little, sorry, lost my train of thought. You know, that maybe she could use some mental health assistance.
I would say if I were to assess her, I would have concerns only because of her living conditions. When you speak to her, she's lucid, she's straight up. I have no expertise in that. I would again present to the court, and if the court felt that that was an appropriate action, or if tenancy protection felt that was appropriate action, then it would be moved in that direction.
Oh, no, I don't mean, that's not what I mean. I mean, just in general, like help, like some kind of, do you think, is she just not even open to any help?
Right.
Because she just sounds like.
She's not going to voluntarily accept help. That's why I want to get this one in court.
Okay, that's what I'm looking for. Okay. That's a shame.
It is.
That's the difficulty with the hoarding itself. I mean, it's just kind of like a catch-22. I mean, that's exactly the problem with that.
I'm not convinced this one's hoarding. I think this one is a case of hoarding is usually a collection of stuff. I get a look inside her doors when she opens that door, and she doesn't have mountains of stuff in there. She's got filth.
I swear you had mentioned that before, and I know you didn't really get a chance to go in there, but I thought you had mentioned that before, so.
No,
There's
been different parts of the town besides Andy that has been there. Some other department heads have looked in windows.
Okay.
With Andy, that I myself, from what I've seen remotely without trespassing, I don't see the thing of hoarders. But she's got animals, and the animals don't go outside.
Right. I remember that.
Yeah, it's more on the filth and I don't want to say hygiene because a lot of people I have never heard anything about she looks filthy, but the living conditions are filthy.
Does she have a ton of animals, or is just a few of them that you know of anyway?
Got 3 dogs.
Okay.
And they don't go out.
Oh. Oh, okay.
I remember you saying that, yeah.
Once I do get them involved, I will include the animal inspector.
Okay.
And I don't know how your older threshold was when she opened the door, Andy, or if it was a warm day. But like I said, that one day on a Saturday, there was 50 outside. I could smell it in the yard next door. God help her. And I mean, for her defense, the senses get sensitized. So if you're in a house with a gas leak, you don't smell it because you get sensitized to it. But if you come from an environment into something like that, and then it hits you in the face like a shovel.
Yeah. Well, it was an issue for sure.
Yeah.
All right, so keep us posted. Vienna.
Vienna, the board asked that I address all the broken glass. I believe all the broken glass has been taken care of. A permit was pulled to do the renovations proposed. He's not moving real fast on them, but the windows, I would say 60 to 70% of the windows are done. The other ones are properly boarded. All the broken glass has been removed. I believe his next step is going to be to work on the roof to try to save what interior he can, and then he'll move to the interior. Again, I don't know how fast he's moving on it. I haven't seen him there since the windows got replaced, but the building looks a lot better than it did. I am still going to be pushing to make it at least appear nicer on the outside. I still think that is a huge visual impact on the town of Southbridge. So from a blight point of view.
What about cleaning up the landscaping?
Yeah.
Because that's pretty raggedy.
Yep.
All right, well, it's good to know that he at least has a permit pulled and he's working on it. So maybe it'll be like Main Street.
And that
All
was the
right.
one, that was the one I reported on last time, as he couldn't pull the permit because he owed taxes. We got the tax thing settled and the permit went through.
Oh, that's good.
All right, 215 Hamilton Street.
215 Hamilton is the blue building across from the coffee shop on Hamilton Street.
Okay.
You're aware that we got a receivership approved for that, but that no receiver wanted it. We finally broke through to the maintenance company hired by the bank. We haven't broken through to the bank yet, but we broke through to the maintenance company that was hired by the bank. They asked us for a month to get it sold. We told them that our expectations were that if they got it sold, we wanted the sale and a proposed plan to repair and a schedule to repair by the end of the month, or we wanted them in to do a demolition permit. So we gave them that window of opportunity. So the end of the month is quickly approaching, being the 15th today. I don't think they'll get it sold for the very reason we couldn't get a receiver. The cost to repair that thing, along with the owed taxes, exceeds the value of the property. So we will be requesting from them at the end of the month a permit to demo that thing.
Andy, do you know how much is owed in taxes on that property?
I do not, it's not ridiculous. Actually, is that the one that's, no, it's not ridiculous because it was paid up right up until till we declared it unfit for human habitation. I can find that out for the board if they want to know.
It's just personal, just kind of curious. That's all.
Building has a ton of damage to the inside. So I agree with the receivers. I don't think it's worth saving.
Okay.
It's a gorgeous, gorgeous building. I would love to save it, but.
All right, 495 South Street.
195 South Street is actually one that's falling under the authority of the building department. We had a tree fall through the roof of that one, I'm gonna say years ago. We ordered it repaired under chapter 143, which is a building department code. We ordered it repaired or removed. He failed to do that. We called what's called a survey team. The law requires that we get a group together and go out, and we all have to agree, the fire department, the highway department, or the town engineer, and the building inspector, and a uninterested party. They all agreed and signed off on the survey that it's a dangerous building. We reissued the order with the survey as the law requires, and the second order, or the second court order that I am submitting to Mr. Caprera to reinitiate court action, is 495 South Street. Hopefully we'll be filing that on Monday, or I'll be filing it with Mr. Caprera on Tuesday or Wednesday. And as soon as he can figure out how to file with the courts, a civil action with the courts, we'll be moving that one up, asking the court to order a demolition on it. Hopefully through mediation, because if it goes to mediation, I'm gonna ask, or I'm gonna include that if he fails, then the town will move on it and take it down. So that one is slotted for court.
Okay. I was just trying to figure out which one it was.
Okay, if the board is comfortable with those, I would like to delve into a couple of more that we've been working on. So if there's no question about 495 South Street, and if you're curious which one it was, it's a red building just as you go around the corner on South Street.
Yeah,
Yeah,
I just pulled it up.
Yeah, there is so much growth. If you're gonna head South Street towards Westville, it is on the second sharp corner on
Okay.
your left. If you're doing 35 miles an hour, you'll miss it because there's a lot of overgrowth, and I've gone by there 100 times, and until Andy put this on here, I could not figure out where it was, and I actually almost had to come to a stop one day, and I advise you not to because somebody's gonna ram you. It's on a bad corner.
Okay. I just trying to figure out where.
Also, the detriment isn't readily obvious. You really
Correct.
have to stop and look at it to say, oh yeah, that is bad. But it's bad. You can see the awning, the walls of the awning are starting to bow out. Some foundation concerns. It's serious.
That's an old house.
Okay.
All right, some other ones we're working on are 36 Thomas Street. That's a little single family. I asked Miss Emily. I went down with Miss Emily. We
I'm
found
sorry?
which
I'm
one?
sorry, what was it? 36 what?
36 Thomas. Thomas is on the, Thomas goes off of Charlton Street, right across from the towers. And the corner of Charlton and Olney, there's a little white house. I have been, it's getting too bad for me to do this, but I have been putting this on the back burner because the town has been on the verge of taking this for a long time. And I think this is one that if the town took it and was willing to forgive the debt, there's $22,000 owed on it, plus probably $5,000 to $10,000 in foreclosure costs by the time we're done. So 32,000 owed on it. But if the town is willing to forgive some of that debt, I think it'll go to auction for short money. It's a little 3-bedroom, a 3-room, 1-bedroom house. Somebody who's living alone, some single person is gonna buy that for $5,000 from the town, put it back on the tax dollar and rehab it for 45,000 and own a nice little house for 50,000. And I think it will work if we let the town take that one and put it to auction. It has, however, gotten to a point where we can't ignore it anymore. So we are going to, we sent an order to clean it and to board it and secure it. We have reached out to 3 contractors to do that, cleaning, boarding and securing and cutting back the vegetation. And we will probably be paying for that, which is gonna be, I'm guessing, in the range of $2,000 to $4,000. And that might be high, but I'd rather estimate high than low. And then my plan is to sit back again and let the town go through with the taking. I think the best action on this one would be a taking. 63 River Street, I'm sure you've seen some action down there, or I hope you've seen some action down there.
I was just there today. I was gonna mention that.
So was
That
I.
was-
It is
That looks-
absolutely phenomenal.
It looks good. All
It's
things
possible.
considered, all this time.
Okay, so we beat the heck out of the previous owners. This owner came to us and we told him that we want some kind of confidence that he's gonna do it because we have an order to take this thing down. We worked with him through the planning board process to reinstate, because it's a non-conforming use. That's I believe, a 1 or 2 family district, and that's a 6-family residence. So we told him that we would work with him if he agreed to take down the building in the back, establish enough parking on site. We would work with him, with the planning board, to reinstate a previously existing non-conforming use. I'm sorry, an abandoned previously existing non-conforming use. So we got that through planning with him. And he has taken down the building, true to his word. And he has not made amazing progress on that front building, but he has made progress and he continues to make progress. So I'm optimistic that that one will come off our list, hopefully by the end of the summer. So I'm very happy.
It looks like they,
Andy,
Excuse me,
when's the last time you went by?
that I went by. I went by to look at, is it 116 or 117 River, which is always a
Yep.
dump.
Yep,
I went by to look at that Monday.
that's still a dump today.
it's still a dump.
Always a dump. Again, we've got ridiculous tickets out on that one. Those tickets have been filed today with the courts.
I
I
drove
will.
by there today. So it looks like they redid the whole, all the porches up the back. It looks like they've all been redone.
Yep.
It looks
Every
good.
window. It looks like every window in River Street has been replaced. The porches in the back look like they're all brand new. When I came from Big Bunny heading east on River Street, it looks like that the west side of the building is completely brand new siding. And they were working on, for lack of a better term, that front tower. So I'm gonna tell you what, if they keep going at the way they're going, that is gonna be one pretty nice looking building.
It's gonna be
They're
gorgeous.
doing really, really good work and fast work, because let's get some more owners like that in town.
I am more optimistic on that one than I have been since I came here. I just mentioned
It's the right owner.
I believe I mentioned 117 River. That one
I
is,
think it's, yeah, 116, 118, I think, those
Yeah.
first 2-3 decades.
all right, that gentleman is the brother of the owner at 318 Main. We
Oh, my
have
God.
cited him almost as much as we have cited the 318, and those tickets got filed today. So hopefully, enforcing the tickets, being able to enforce the tickets again, will have an impact on his response. 314 Hamilton it's always been a dump, but recently it became, and by a dump I mean literally the messiest yard. It's the one right at the bottom of Pine Street. If you go straight across Pine.
Oh, that is the white building that has all the garbage in the driveway.
Correct. And
That is-
recently somebody backed in there with some sort of truck and dumped a truckload of household waste there. So
Look up in the GIS. I think that used to be Dr. Haling's. That's why I'm an old guy.
A gentleman who just passed away. He was also the one who owned the property up on Dresser Street that was a pain to us. So he passed away. So we are sending an order to the estate of, because nobody has probated the estate yet. And I don't think they're going to, because the value is just not in it. They would take it at a deficit. That is one that has already been gutted. It's open, so we are going to order it boarded and secured and everything on the exterior straightened out. But I'm going to call the Attorney General on that one and see if there could be any interest in a receivership on that one and try to move it through them. I will probably arrange for a cleaning at the town's expense if I can't get the there is no owner, so I won't get the owner to do it. So that may be cleaned at the town's expense, and then I will hopefully move the building into receivership. My estimate is there is 15 to 25 yards of trash and debris outside that residence. So it's not going to be a cheap
That was
fix.
314, right?
314.
Yeah. That's the son that had the constant yard sale at the bottom of Denison. I'm very familiar with.
Yes, that one is being foreclosed on. We actually went to him and he had to clean his property. He did not.
Because I was in the fire department, picked them up in the ambulance for 30 years.
Yep.
Point taken.
The one on the bottom of Denison that you mentioned, I wasn't going to bring it up, but he did have the property a mess. We tell him to clean it. He kind of organizes it better, but so it doesn't look as much of an insult as it did. Still not pretty. That property is being foreclosed on also. So getting him to comply is also a headache. But and that one is actively in foreclosure right now.
At least he brought the crap inside the fence instead of outside.
Yep. Next one I would bring up is 61 Crest Wood. This is up near the Idlewood property. This is a ranch, always a mess. It's a beaten down ranch, but I don't think it's an impossible task. So we have some violations on this one. We cited the owner. Nothing's happening. So this is one I'm going to call the Attorney General and try to get a receivership on.
Okay.
I am going to walk the receiver through 36 Thomas to see if we can just bypass the whole foreclosure and see if it's worth somebody taking. But I don't think it will be with, like I said, the property's probably worth 80 grand to 100 grand if it were fixed because of the size of the building and the size of the lot. And they owe 22,000 plus whatever debt we are going to incur over the next 2 to 3 weeks cleaning it, plus the foreclosure costs that we've already incurred. So I don't think a receiver is going to take it for its value, but I'm going to walk them through it. And the last one is.
It's assessed at 74, so.
Excuse me?
It's assessed at 74,000, according to the assessor. So, yeah.
Yeah, I just don't think the value is there after they pay the debt. I think the way to get rid of this one is let somebody buy it at auction for cheap money and the town takes a hit. And we lose the 15 or 20,000, but we get the thing repaired and back on the tax dollar. If that don't work, well, we'll have, in order to auction it, we have to own it. So if that don't work, we can go in and take it down without fear of repercussion. So it will make the demo process a lot easier. And the last one is one of my
What
favorite.
number Crestwood?
Excuse me?
What number Crestwood?
No, Crestwood is previous conversation 61. I'm talking
Yeah,
about $36.
Yeah, I know. I'm trying to find 61 Crestwood. And
I can't find it either.
Obviously, the GIS is screwed up on where Crestwood and Idlewood.
Let me grab it.
19 Crestwood?
Oh, I'm sorry. I'm thinking 61 Idlewood, 19
It's
Crestwood.
Idlewood.
My
Okay.
apologies. You know
Because
why? I wrote it on my board.
my cousin used to live at 51 Crestwood, and then it changes to Idlewood.
No, my apologies. I wrote it as 61 Crestwood because I had 61 in my mind. It's 19 down lower. That's 61 Idlewood. I want 61 Crestwood. It's 19 Crestwood. I'm sorry. I think it's a very viable piece of property. I think it hasn't been vacant long enough to have run down and been unsavable.
Oh, okay. Yeah.
It's beat, but I think it's savable. New siding, new roof. Actually, the roof looks good, I think, but new siding, take down that ramp and clean the property. And I think you got a decent little house there.
Okay, I know the house, yep.
And the last one I want to bring up, I'm going to bring the Attorney General through this because we've made significant progress, but it just stopped, is 361 Worcester Street. It's been my favorite since I came here. I have run into every legal snag in the book on this one. I think the owner has finally given up fighting me. So
Hey,
this is one
Roland,
that I'm going to ask the Attorney General to go through and take it.
didn't you mention that the mailbox is gone?
Yeah, don't worry about that one, Andy, because they're not going to be able to accept mail anyway, because I noticed today that the mailbox that used to be on the wall at the front, yeah, that's gone.
All the cars are gone too, except for that Miata. But
Well,
if you go in the backyard behind that canoe,
nothing's
if you go in
changed
the
since.
backyard behind the canoe, it is no less than 12 feet deep of solid debris. So for the cost of cleaning the property, somebody's going to own, some receiver will get a two-family. I think that one is probably our most optimistic that will be accepted by a receiver.
All right, anything else?
That is all I got unless the board has specific. Oh, Beth, 66 Central Street.
Oh, I was just gonna ask you what was going
There's
on
a
with that.
dumpster, there's a dumpster, there's work being done.
There's a dumpster. There's no trash to the right of 70. I mean, to the left of 70. He is pulling a permit to turn the rear into a two-family per the court order. It's a new owner. He's out of the North Shore somewhere, and he's looking for auctions in town to buy more properties. So hopefully he'll be a positive effect on the town, and I will be happy to refer others to him if he proves effective in this one.
So I'm already hopeful just based on that information, because how long has he owned it? Not long.
Correct.
That makes me happy.
Maybe
Does
he'll
not
be
appear to be a guy who holds on to assets. He appears to be a guy who takes an asset and makes money off the asset. So I think he'll be good for that neighborhood and hopefully for Southbridge as a whole. He's from the North Shore, but he owns properties in Fitchburg. He's pretty widespread.
Yay. All right. Well, now it's 7:49 and we need to review the proposed solid waste regs.
Just thought I could hide. All right, so I emailed 2 documents, one showing the changes that had been suggested and discussed at the last meeting, and one clean copy And if the board is comfortable with these changes, we will move this to the hearing and basically get them in there permanently by, what's today, April, by May's meeting. I think we can pull it off pull off the hearing in May's meeting, along with the adjustment to the fee schedule. If everybody was comfortable with what we put in there and this final draft will work.
Roland?
I didn't have a chance to read it all. I mean, if it was taking, I mean, I see that one on 530 that was added, and that was the one we talked about because of Lower Main Street. We kind of hopefully solved many of our problems by saying 6 units per parcel, so we
Yep.
don't get into that again.
Nicole, did you look through it?
I didn't get a chance to look thoroughly through it. I had seen some pieces, but,
Oh, no, it's
Yeah,
okay,
yeah, that's
because honestly, I did not either. So I don't know if we just want to take a little bit and
yeah.
just do it next meeting, and then we can
Yeah.
move on from there, just to
Mhm.
double check it, and that way, you know, we're not like, I don't want to lie.
Yeah, no, I agree. I
Well,
agree.
I think we've spent enough time on this, that we are right at the point that if we, it's going to give us, I didn't have enough time to go through this. We did go through this, and it looks briefly on, you know, I'm just briefly looking at the dirty one, for lack of a better term, with the blue
Right.
changes. And it looks like most things are addressed, but on the chance of do it once, do it right, I think if we spend this month before we send it for a public hearing, and it should be a quick agenda item for the next meeting, let us read it over. It should be a yes or no, which I'm sure it's going to be damn close to a yes. And if there's some minor changes that they're, you know, some minor typos or something stupid like that, we can make the changes, but schedule a public hearing to get it done. But I'd like to have some time to just go through it because, I mean, the fee schedule, I looked at that, that's cut and dry, that's good.
Yeah,
It's
the
only
fee
2 of them.
schedule is
They're in
fine.
there. It's just to have the clean copy so that when this goes out to a public hearing, we don't have anybody to say something stupid. We've got all our Ts crossed and Is dotted.
Okay.
So
So
I
will
would propose, let's take until the next meeting to give this a look through. And then we'll take care of it, finalize it at the next meeting for a public hearing, if that pleases the board.
Okay.
I
So
think
that will
so.
put
You're
the
okay with
hearing-
that, Nicole?
Yeah, I agree.
That would put the hearing in June, probably good timing because we can institute it with the new fiscal year.
All
If the
right.
board adopts it, we can make it effective as of the new fiscal year, which will be July 1.
With the fee schedule, right.
Correct.
That's good. I think that works.
And then we can advertise it so that these real estate agents and stuff will have something tangible, or these new owners that they can throw in the real estate agents and say, you go pay it because you sold the house without it. All right.
All right, so, sorry, so we'll just table it till the next meeting.
Continue it.
What?
I said,
Continue
we'll
it.
continue it. We made a
Oh,
decision.
continue, yes.
We'll continue.
I'm sorry, yes, we will continue till the next meeting.
Yeah.
All right. Agenda item number 8, chairman announcements. I have none at this point. I got nothing. Number 9, health director announcements. Andy, got anything?
I just have 2. We bought some rain barrels. We have distributed all of the rain barrels we bought. So we bought a second round of them. We have rain barrels again available. We had people come in and buy 3 and 4 at a time. I think because of the zest for these things, we'll probably limit it to 2 on each round that we buy, but just let the public know that we have more rain barrels if they are interested in them. And we sell them for $25 a piece, Ms. Ritz? $25 a piece. And the other topic is we have a Beautify Southbridge every year. Unfortunately, last year we didn't hold it basically because of the newness of COVID, and we were worried about social distancing and everything. I think we've got a decent grip on how to instruct people to stay separated, stay within household groups. So we've decided to put it before the board, schedule the Beautify Southbridge for May 22nd. And if the board is in support of it, I'll make the announcement that we want to do a Beautify Southbridge on May 22nd, asking people to stick in their family groups who will make the meeting place at the town hall. We will somehow form a one person at a time up. We'll give them bags and send them out on specific streets. I think it's important this year because going around the streets, one, to Ms. Nicole's continuous concern, I think it gives people something to do and gives them a purpose again. And two, Southbridge streets are looking rough this year. So I think it's a perfect opportunity to start the year right, get it beautified, and hopefully get a little more pride in the town.
So,
Yes, no, I would agree.
just real quick, would it be easier instead of doing the setup at the town hall for space reasons? Would it be easier to use the common?
I was thinking that actually, yeah.
So that then people could just, you would be able to have that distance.
I have been talking with, every year we've done this with Center of Hope. Center of Hope backed out this year. So I've been working with April, who is, the girl is just nonstop benefit to the town. I will give her them kudos. And we think that we can pull it off with her, myself, and Miss Emily, and Miss Maritza. So we'll have a much smaller crowd doing the service at the point of distribution. And I think we can handle it. The reason I want to keep it at the town hall is because everything we used to set up is at the town hall. The tent is here. We can just throw that outside. We can put the banner out front. I can reach out to April and see if she thinks there would be a benefit to moving it down there. I myself don't see the detriment of holding it here. I think we can keep the people separated, but if the board wants me to investigate it, I will.
I mean, it's just a thought. I mean, I'm not married to it. I just was thinking that, for space, then there wouldn't be the potential. That's all.
Yeah.
Nicole, you got anything?
Yeah, I just had a question. Any advertising going on about that, and where are we advertising, if anything?
We have not yet. I want to get the board's input and support before I do that. We have developed the flyers already, and we will we'll be posting that to our website, to the Access TV, and to the town Facebook if Mr. McCall is amenable to that, and probably to the police Facebook because they've got a much bigger following. We'll also be selectively putting it in storefronts. Elm Street Center is one, library is one, and probably Big Bunny and Big Y if they'll let us.
Yeah, library is good. I was thinking about that too. Right.
Is the library open now?
The library is normally good, but access into the library is limited, so you're not getting the exposure we need.
Almost like by appointment, yeah.
Yeah.
But they when people go in, or at least on the side, they can see if there's flyer posters or something. So I'm just curious.
Another thought on that. I mean, if I may, Madam Chair.
Yes, go ahead.
For both things, Andy, maybe the rain barrels and stuff, that it can go to either Mr. McCall or Mr. Jovan to go on chairman's or manager's announcement. But Holiday Visions did it to beautify the town for the holidays. And I'm sure we'll be amenable. A lot of people, like the library is kind of a bottleneck as far as access, like what's been said.
Yep.
Get them posted in the schools. Because the other thing that I've seen and I've heard down at the clinic, especially when we have nursing students, these other kids that need public service for their scholarships,
Yep.
and all this other stuff, it is damn hard to come by. And it's been kids going and volunteering at the clinic and stuff like that. And it is tough because at the clinic, they got to be quarried. So there's a lot more hurdles. But so many kids that want to go to college, a good college, needs that for like the National Honor Society and so on and so forth. And with this COVID situation, it's very hard to come by. So I think advertising it up there might grab a ton of resources and groups of kids, never mind family members. But if you have your class or your, I can't remember the term that the school uses for their different A and B groups. But I think that'll be a positive thing to get people out and about and get it done.
Is it possible to submit that, to the actually like, the school itself, so they can kind of disperse that?
I think I can reach out to Dr. Villar or to
I was
Margot.
gonna say if you can send it to Margot and see if that's okay,
Yeah.
because I think that's a good idea, as long as they, stay in small groups, I think it's fine. I think it's a great idea. I'm totally in support of it, and I will try this year.
Keep it
I will
small.
try this
Remember
year
the
to be
mask.
there.
Yeah, keep it small. Remember the mask requirements, especially when you take pictures.
But yeah, I'm in support of it. I think it's a good idea.
Right.
I think it'll do more good, I think, at this point than it will harm.
Yep. If you
I
remember,
agree.
if you remember last year, the town manager was, in my opinion, possibly overly cautious, but maybe rightfully so, under the circumstances. Mr. McCall has already commented that he would support this.
And
Well, that's
we've
good
learned
to
a
know.
lot. Society has learned a lot about this disease, so we've been able to understand it more. Good.
All right. Board members, Roland, you got anything?
Yeah, unfortunately.
Did I
Andy,
let Nicole
you and
go
I-
first? I'm gonna start picking you first, Nicole.
Andy, you and I had a conversation. We also had some headbanging about communications. You and I talked about, I told you about complaints to a funeral home in town. You said you were going to reach out to them to basically tell them to smarten up and follow the rules. Were you able
Yep.
to?
I made one call right after our conversation, and I forgot to retouch base. I'll do it,
Okay.
but I did attempt.
And to be honest with you, that's what I've learned, and we've had our discussions on emails, and that's what I've learned because I keep the things in new mail until I get it done. I mean, that's my system. It might not work for you. At the last meeting, I brought up containers on Denison. I backed it up with an email on April 8th.
I saw that. I came into town this morning early, and I got sidetracked by another thing before I got up there. I was on Everett Street this morning.
Yeah, but don't we have a solid waste inspector?
We do.
You shouldn't be doing all the shit yourself. You got a
I am
million.
not.
And the whole point is, and the frustrating thing is that I've heard nothing. And that is really frustrating. Again today, because it happens to be my neighborhood, and I'm not going around town looking at other people's pickup. We have plenty of people that call us on their neighborhoods. But Casella is still picking up the damn stuff. There was a lot of recycling that was stacked up outside the recycling bins because they were full. You know something? I'm glad it wasn't windy, but people are recycling. That's a positive. That's why I asked you for 2 more recycling bins at the community center. I mean, when I got them to cooperate, and we are now filling 8 of them to the brim, that stuff not going in a dumpster. I am absolutely good with that. But we're doing these bylaws and stuff, and like I said, that 489 Denison is, I think, that one we discussed on, the hell is it? That little house in the corner of Worcester and Martin Street. New tenants, new owners. They're not aware of
Worcester and
rule.
what street?
Martin. Remember the one they were leaving their little, it's a little two family, they were leaving their buckets out on the sidewalk 24/7.
Yes.
And they were new people to town. And you know what? We don't have to treat everybody like Hunter Foot. You know, they're like kids. If they appreciate the rules and gee, I didn't know, I do this every day at the Armory. I didn't know that, I wasn't told. Nope, this is why we work together. If they tell you to go poop in your hat and get off my property, well, now we'll have to take it in a different avenue because it's the rules. And we have to do for one that we have to do for the other. But I will say that, you know, and not only for the people, because, you know, the people are going to be like kids. If they can get away with it, they're going to try. But Casella's still picking this shit up. And they were doing really good for a while and people were learning. Why wasn't my bucket picked up? Because it's not the right bucket. You know, that day I told you about Briarwood, the recycling was all over the area because they put it in the little blue plastic containers and it was windy. The regulations, even before we started it, because you can go to Dr. Tumalo's, he purchased a second container that follows the regulations, has the grab bar, has the cover that's attached, and they made a stenciling that says recycling. They're allowed to do that. This person used the old bucket, like there's several others, and on a windy day, forget it. It's everywhere. I don't know if you caught them before, but they did pick it up on the end. But you know something? It's like the pig behind me. I picked his stuff up when it bounced off my house on a windy day. And the rest of his crap went across the street. So he didn't pick it up, somebody else did. But it's just the communication it's vital. And I don't need a very big dissertation.
Yeah.
But like, God help us all. You know, we took an oath, and I am going to continue to email. And even if I talk on the phone and send you a text, Andy, check your email. Because like this nursing home thing, this is the second wake that I've got, besides the wake that was the original problem from the same place.
Mhm.
I have not heard any other complaints about our other two. But I'll be hell-bent if I'm not going to have protection for myself to have it in writing that I forwarded the complaint. And that's the only protection for us.
Yep.
Because if you go talk to him and he says yes, 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 and God help us if we have a breakout, because yes, 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 verbally, there's no evidence. And I am just right now I am very concerned about his attitude of having really caring about following the rules versus the bottom line. So, I mean, when you get people that tell you I left the wake because I felt unsafe, that's a damn shame. So that's all I have for now. I was going to bring up, you know, River Street to end on a positive note, but I'll say it again. You got to go by that building. It is absolutely gorgeous. And maybe he'll be interested after he gets this. Maybe he'll be interested in the, what is it? 117, 119, 318 May. Maybe we can pop a postcard.
Roland, if I can just comment, I know this is not what you're talking about, but I just want to put it out there that if somebody calls me up and says I have a large bunch of cardboard, I have, and I know this is not what you're talking about loose recycling, but I have told them that if they bundle it and put it beside their recycler, that I will have Casella pick it up. So if they have large cardboard or large bunches of cardboard, I have authorized that they can put it outside the container beside it. Just cardboard.
I do that all the time.
Yes, I will tell you, people have asked me, and I said, listen, break it down, but bundle it and tie it up or tape it up so that if there's wind, it won't fly around like a kite. And then people go, oh, I never thought of the wind. Okay, that's good. I am absolutely good with that.
Yeah, okay.
The stuff that blew around was cans and small boxes and stuff, because that was just an improper container.
Yep, okay.
And if they bundled the cardboard, they could have put the other stuff in the regular bin. But a little education goes a long way.
Do they have a regular bin? The last time I went up there, they just had the small one. They didn't have a regular one outside.
No, they had, there was, the standard 96 gallon recycling bin was
Yeah, that's no-
overfull. And they were
Okay.
using, now, again, you took a multifamily and showed them how they can recycle and break stuff down. You know, maybe the crap wasn't broken down. I had the same problem at the Armory with the hospital. They were filling the things up in a day because they never broke anything down. Now I've been able to, hopefully, knock on wood, train them because everything's broken down. The guy actually has to shake the bucket.
Okay.
That's all I got.
All right, Nicole?
Why is there an echo?
I don't know. You're muted. Nicole, you're muted.
Line. Oh,
There you go.
I'm back. I was trying to look for another cord because my phone was dying, so. Actually, just wanted to share something that, you know, I kind of thought I came across. I think it's great. I know that they're working on the bridge fridge, but in the interim, I don't know if you've seen it on Focus on Southbridge, but in Sturbridge, it's still open to Southbridge residents too. At the Sturbridge Coffee Shop and also at Alternative for Health, there's a food pantry, 24/7 right out front. Yep, so just to kind of share. Yep, I think that's great, yeah. So in the interim, just put it out there and share it, you know, so it's another resource to use.
Yeah, I saw that. I was trying to figure out where it was. But I'm glad you mentioned that because I saw that and I thought that was really great.
Excuse me. Just over here, before I die. Do you know where that is, or?
Oh, it's where did you say was it?
Do you know where the Sturbridge Coffee Shop is? You know where, oh my goodness, where,
By the steak
TJ
place, right?
TJ O'Brien, you know where TJ O'Brien's used to be in Sturbridge? That building right there.
Oh, okay.
Yep. Right there. That's the Sturbridge Coffee Shop. And Alternatives for Health is that if you're going into Sturbridge, it's on your right-hand side. You know where the Yankee Peddler is?
Yes.
In Sturbridge? Okay, it's right across the street from that.
Okay.
Yes. Yeah.
That's the one I was trying to figure out where it was.
Right. Yep.
Okay.
So, just good to have other resources, you know.
Yeah. Do you know what? Because I feel like I know I saw it, but I didn't really get a chance to really look at it. Do you know what they're stocking in it? Is it?
It's just staples. Like they could have, like, you know, macaroni and cheese in there. I mean, they could have just, I mean, again, it's all, you know, non-perishable things in there pretty much. But they try to keep it filled with staples. I haven't actually gone in and seen it, you know what I mean? But I do plan actually on this weekend taking a swing by.
Oh,
and
I have to
checking
go
it out.
check it out.
Yeah. Yep. Absolutely.
Great. Thank you.
You're welcome. And not forget it for now.
All right. Schedule next meeting.
Second Thursday in May already will be the 13th. And hopefully I'll have a report for you on how the air conditioning is working down at the center. Because that's due to go in.
Same
That's
time.
due to go in on the 3rd.
We doing 6 p.m. on May 13th before my phone dies?
I don't see a problem. You, Beth?
No, I think it's fine.
Sounds good. Sounds great.
All right. Motion to adjourn.
So move.
Second.
Yes.
All right.
Stevens,
Yes.
Roland LaRochelle,
Yes.
Bill Duffy.
Yes.
Thank you.
All right. 8:14.
Have a great weekend, everyone.
All right, kids. Have a good night. See you soon.
All right.
Bye, Andy. Thank you.